Good afternoon, friends. Welcome to our Talking Tuesdays. My name is Tanvi. Wish you all a very, very happy Diwali. And I hope you had a wonderful, wonderful time during Diwali. Unfortunately, times like these, I'm sure most of you wouldn't have been able to, meet a lot of friends and family. But I really hope that you had a good time. Hi, Anshika. Hi, Shivangi. Our topic for Talking Tuesday today is strong baby, and we are loving all the love that we're getting for our this series, Know Your Baby. A lot of you had been asking us, to put all this information together. So we are planning to actually put this up in a course and would be opening it up for a lot of you with more information. So I'm just going to check if my friend Divya is here. Hi, everyone. Okay, here is my friend Divya. Hi.
Hi,
Hi, Divya. Wish you very happy Diwali.
thank you. How are we doing post Diwali?
Oh my God, the Diwali blues.
I think it's exhaustion.
Complete
Even though
exhaustion.
it was so low key, I feel exhausted.
True, absolutely. Little work or no work or more work, I think it's just pretty exhausting. Yeah. So, our topic for today is strong baby. And as I was telling everybody, that thank you for the love that you've been giving us for this series. And, even on our YouTube channel, we've been getting, comments on,
Oh,
yes, especially around exploring your hands. So, Pavitra had written yesterday only that, she loved watching it. And thank you for the advice on no mittens. So,
wonderful.
yes, thank you.
Okay, so we are ready to talk a little bit more about babies. Seems to be my favorite topic, and many other people, it seems. We just want resist babies, can we? And today we're going to talk about the strong baby, which is a paradoxical statement because we don't generally see our babies as strong.
Yeah.
So, couple of ideas I want to throw out there before we build on it, and one of them being that how is strength developed? Think of your own self and say, today you want to build muscular strength, say in your arm. What would you do? Tanvi, what would you do?
Mm, weights.
Weights, and that you'll be lifting weights, right? Now, if we want the baby who we think is not strong to become strong, we have to offer him an opportunity to exercise. Let's park that thought for a moment and then go to the idea. If you listen to all grandmothers or great grandmothers' advice, we would put our babies to sleep in many different positions. But since we are influenced a lot from America specifically, especially the medical system, because we follow similar guidelines, uh, in 1992, Association of Pediatricians in America, which is AAP, said back to sleep. They started a back to sleep program, and that is because they were considering all the SIDS that was happening, and they found that when they put the babies back to sleep, which is in on their back, the cases dropped quite a bit. And then that advice started to percolate out, and now we are hearing these really strong this thing about putting the baby, on the back to sleep. Given with it all the conveniences we have in today's time, may it be car seat, maybe baby carriers, may it be walkers, we are finding that we're putting babies in positions where we're truly not letting them do what their bodies need to do, which is exercise, which comes by reflexes again. Remember, reflexes are these coded mechanisms in the baby's body that aid their development. And they're not just random and we don't know why they're there. They're there for a specific reason. And these would then allow the baby's muscular skills to develop. So both muscles as well as neuro, which means brain. And so we are trying to get them all together. And for that, much later, a lot of occupational therapists found that there were developmental delays for the baby in sitting, in crawling, in walking. There were delays, in terms of, gross motor skills, fine motor skills. There were deficiencies. And they said that these babies are spending a lot of time on their
On
back,
their back.
right? Now, what happens when we put a baby on his tummy? And then those babies would then push up. Even newborns, even a day old, will push up and lift their head. And if any mama has ever done the breast crawl or has laid back and put the baby, babies will lift their heads to look at the mother. And that is a really good chest, shoulder, arm exercise. When they lift up, their hip and knees press into the ground to allow that levering up. That's an excellent growth of their proprioceptors because they're now feeling gravity and pressure with their body. So we're talking about movement, we're talking about balance, we're talking about sensing through the body. And these are the skills that they are developing right from the beginning by just tummy time. Now we're going to get into that in a little bit, but why is that so important? So we think that in this world, if you can hear and you can see that, that's integrating a lot of information. But over the series, both the prenatal and now, we say how the baby senses the world with all the senses. And have you ever seen somebody play a piano or a tabla or anything else? Their fingers know where to go without looking at it. So visual is not involved, but there is a sense of spatial orientation of the body. Dancers, that's a proprioception, and also balance, vestibular, and these develop by simply putting the baby on their tummy. And I remember a lot of times when my son was young and my husband's grandmother was with me, she would put him on the tummy and she would watch him and then she would talk to him, encouraging that social baby to connect by lifting his head up and looking at the voice. But see how her connection or play with the baby was actually making a strong baby. And the way it goes is that with that opening of the chest muscles and the strengthening of the abdominal muscles with the pressure of the hips, babies will be able to have core strength, which will help them sit, stand, crawl. Crawling is about lifting your body weight up and moving with your knees. And so many of these developmental milestones are just not something that you will take on the pediatrician's booklet, but there's a process of getting there. And tummy time is one of the simplest way of doing it. So, when people say tummy time, now this is yet another thing on their checklist that I have to give the baby tummy time. But how do you decide that?
And for these many minutes.
Just like a massage, you don't have to watch the booklet. You have to watch the baby. So, we talked about states of consciousness. When your baby is in a quiet alert period, that may be a great time to do tummy time. It may be very easy for fathers to do tummy time by lying down and putting the baby on their chest and then talking with their heads raised a little bit. And the baby will look for the father's voice. A newborn baby may need only 5 minutes of tummy time in the beginning in a day, which is not all at once because their concentration spans are small. Their brains are just beginning to explore the world. So giving them that time, but being, on the mother's chest. How fathers can even hold the baby in their arm. They put the head on the side like this, and then
Yeah.
their tummies are here. Even that which may be very good for soothing them, but also giving them tummy time. And the best is that if your baby is playful, is awake, if you put them in tummy time on the bed, and you go down at bed level, eye to eye level, and you talk to them, that would also have an interaction where they are kind of orienting to you. Can you imagine the workout their neck, their chest, their shoulders, their arms is doing, picking up their own body weight? And so that may be a great way of including tummy. So it's not like, oh, I have to put my baby on a tummy. And a lot of people give up on that because when you put the baby on the tummy as a tick mark, one thing to do, they may cry. They may not like it. But newborns can tolerate tummy time. If you start right from the beginning, you find that it's something they enjoy doing. And then
Right.
as they grow, then you can put a toy and they can reach out. So one of the things which I read and I found it very interesting and it hadn't struck me was that tummy time will develop the core, which will then allow them to use their hands separately. Because you need a lot of internal strength to balance, to move one hand back or stand on one leg. How many of us can do that? Even now, because we don't have strong cores by sitting down and not using gravity, we don't develop a core muscle, so or we let it go. So we find balancing very difficult on one leg. But all of that arises when you have this central system working really well. And it's as simple as putting the baby on the tongue. And so, we are the baby is strong or with potential for strength, coded, and as we follow those pathways, as we play, as we introduce the baby to this world in all directions, this baby is going to become a strong baby. And because the chest is strong, the arms can be used. Because the arms can be used and supported, the fingers can be used. So even fine motor skill, which is the really detailed work their hands can do later, is dependent on how their chest and shoulder was developed. And then because of all the conveniences we are bringing in, we are taking that away from we are using a lot more equipment, which is taking away their strength and their development. And I want to start from car seats, um, baby seats. So we're putting a baby in this position, and because there's no core strength, they will slump down, and they have no neck strength, so their heads will go like this, and they will continually be in these positions. So it's not saying don't use these, but if you're going to use it, then what is the duration you're using? Because I've seen people say, my baby doesn't sleep, so I take them for a car ride and then I let them sleep in the car seat.
In the car, yes.
We bring that back in and you let them sleep in the car seat. Now that's
In
a
fact, these
prolonged
days,
period.
even the strollers are coming with the accessory wherein you can just put that baby seat in the stroller and let the baby sleep in the house in that seat. So they are in that position.
So not only are we alienating these babies from our body, which is how they know the world, their sensation is through the mother's body or a human body, but we're also now putting their spines in a position which can then lead to a flat head or even a twist in the neck, a torticollis. And that's how the body starts to adapt and grow because that's a constant position. For some babies, you'll realize because the space in the womb was a little bit restricted, they are in that shape. So their preference of their neck will continue to be in that shape because it has developed like that. And that might need a little more help. And tummy time will develop these muscles and offer them, a resistance back. And also watching that they're sleeping in a position where gravity is supporting this system where you can move their neck. So, babies may have a preference of looking to one side. So what you can do is then, if they're sleeping with their head on this side of the crib and legs on this side and the mum is on this side and she's talking or they're lying like that, they may have a preference to lick this side. So we put them on the other side and we call them from the opposite side. We're now encouraging in there, instead of moving it, which will not work because we are encouraging constant movement to the other side. And that can happen with play as well, which can happen. So, your orientation to the baby, engaging with the social baby at the time when the baby is in a quiet alert period will help them exercise their bodies to come into a better form. And that's about, how we talk about um, car seats. Now, some of us also use carriers. When we're using a carrier, and it's great to wear your baby, make sure that their thighs are well supported. Firstly, in the newborn period, in the first 3 months, their legs should not be pulled apart because then their pelvis is pulled apart. And we want to put them in carriers which support their neck from going back and their knees in a little bit of a frog position. But as they become older and we put them in carriers with their legs hanging out, the thigh has to have adequate support. Their thighs cannot be hanging down. So that's another equipment use that we must look after. And then as they grow older and we put them on exercise saucers or walkers, before they show indication of being of walking or getting up, that may also be detrimental to their health. Because as they stand up and they put the load on their foot, which they kick with, the muscles and the bones are not quite ready to take that weight. And that's when they may have a chance of becoming bony, but also later in life having a hip pain and so much more developmental issues. So when we are using equipment with babies, we must think how we can balance that, because we do go in cars, we do need car seats, we do need all of this. How do we balance that, allowing baby free play right from the beginning, right? And so that would be our, it's a really, really important thing because
So,
once this, yeah,
so Divya, in terms of for baby carriers, would you recommend that initially, parents should ideally use a wrap instead of a baby carrier, and then once baby is slightly older, a few
yeah,
months, and then move on to a
most
carrier
carriers, most carriers are meant for babies who can hold their neck up,
neck?
right? Now, that developmental stage of holding their neck upright can be facilitated by giving them the strength training of tummy time. Because you'll find more and more parents will say, my baby walks with no balance, my baby is delayed in walking or crawling. And sometimes instead of crawling, they scoot, which is they pull themselves up rather than go up, lift their weight up on their knees and hands. They just crawl, they just pull themselves up, which is a skill they have even when they are newborn. Because when they are born, they have a reflex to push with their feet. And so there's something that we want to talk about that, but in a minute. But all these developmental stages, so even though the carrier says that it's for 3 months to so and so, you must make sure that the baby's head is actually stable and they're not getting a whiplash. But on the other hand, if you hold the baby leaning forward, you don't have to support the neck because the front bending the neck tolerates and their instinct to lift their head up is actually giving them some strength training. So when we are holding babies, newborns in a forward leaning, allowing them to lift their head, trying coming at their eye level and talking because they engage with their eyes and audio visual engagement. This is all encouraging, well, strength training, yes, but also bonding, also speech, also communication skills, also safety by looking at the playfulness of the person engaging with them. So basically, what we're doing with babies cannot be, oh, I have to do this, 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 and this, but can I engage or meet the baby where they are so that they can show us what they're asking of us and enjoy it while we're doing it. That's the most important thing. Do we enjoy the interactions with our children, because that would then make parenting such a happy thing. It's still exhausting, it's still hard work. You still might have many a week and bad moments, but it's a joyful experience because not only is the baby bonding with you, you're bonding with the baby as well. As entrainment happens, as communication happens, which may be completely non-verbal, you look forward to that communication. There is something to build on. But in that interaction at eye level, in a state of quiet alert, when the baby is receptive, when you keep in mind, is the baby getting a rounded exploration, which means adequate walking and rocking, adequate contact with the care provider, mother, or anybody else who cares, social engagement, enough sleep cycling. We're putting them all together. When you're following the cues of the baby to each of these pathways as we are presenting them, and then you're tuning into that, parenting becomes quite instinctive. You will find yourself coming to insights about the baby, and that'll be unique to your child and not to anybody else. And that's an important thing as well. And kind of jumping back to the point where I said that the baby is capable of pushing, that should remind you to not leave a small baby unattended in tummy time, because they can, if they get their foot hooked onto something, they push against it and can scoot forward. because that's how they come to the breast crawl and come to the breast because they push with their legs. Even if you put your hand behind the baby's feet, you will find as soon as the foot touches your hand, they will push against it. And that's strength in them already there for a purpose. If you put your hands and they grasp it, we talked about it last time, and you lift them up, they can lift their body weight, which means they start with enough strength to pick up their body weight. How do we take it forward and not lose that muscle tone that they've come with or build on it, what they've come with? That would be a me time. And if you have a grandmother at home, they will they've always said, put the baby in a way, put him on his tummy. They would put the baby in the tummy if he's gassy. They would put the baby tummy on the tummy, when they birth them right next to you, leaning back, rubbing their back. So there are many opportunities of tummy time. But we have now become very, no, we know that swaddling is good. So we just swaddle the baby and isolate the baby in his own room, which is quite frightening for me. But sometimes, as far as the baby is concerned, his own cot with nothing, no sound around it would seem like, okay, I'm on my own. There is nobody there. So, how all these different pathways are painting a holistic or a three-dimensional picture of the baby where you can take it forward to include it in the way you parent. And in the beginning, parenting is a lot of physicality, a lot of you talking, the baby responding, and then it becomes a two-way process. Very, very quickly.
Right. So, there's just one question, which is, I don't think related to this topic, or it could be, but somebody is asking about the Indian jhula, the hammock.
In the beginning, yes.
Is it a
No.
risk for SIDS, or is it a
Okay.
risk to put the baby in a hammock?
Okay. So I want, if you want to do some research with this, you say, firstly, we don't hear of it in India. And there are very specific guidelines that AAP tells about it. And one of the guidelines interesting is to give the baby a pacifier before the baby goes to sleep. And I find it really odd that we're not really connecting the dots. And this is just purely hypothesis on my part, but it's just kind of thinking the dots through. We are talking about a culture that isolates babies. And we talk about how babies need another care provider to regulate, right? So these babies are feeling stress in their singular environment, their isolated environment. Add to that they may be bottle fed. So there's no human contact, but they also may be bottle fed. And so their self-soothing mechanism is also diminished. And then on the opposite side of this, we are saying give the baby a pacifier for what? What would be the purpose of the pacifier that we are giving to the child before he goes to sleep? So the purpose of that pacifier is to allow the baby to self-regulate before he falls asleep. Now, I'm going to just shift gears very timely from here to trauma work. If we look at the somatic pathways of trauma, when people get extremely stressed out, they move into what is called a freeze phenomena, which is their body temperature drops, their heart rate slows down, which we also read signs as depression, and then even further, almost a shock. Now, when babies with such small brains and such weak, or well, weak maybe not, such a nascent system of self-regulation are put through chronic stress, would they not also feel the sympathetic slowdown? And then what does it mean? I mean, nobody's been able to explain SIDS. They say we don't know why, but the baby just stopped being alive. And slowing down of heart rate, slowing down of breath, not able to arouse themselves, lethargy, loss of muscle tone. These all lead to a state of near death. You know how we say you frightened me to death? That is, it's a metaphor for what your body does when you are frightened beyond control or beyond your ability to tolerate it. And then we are offering them a pacifier to kickstart their nervous system to regulate back into working. And then that's one of the protocols to avoid it. But if you were co-sleeping, if you were regulating your baby, if you were wearing your baby, if you were responding to your baby, if you were interacting with your baby and you were breastfeeding, you might actually mitigate this idea of things completely. So for me, chronic crying is a stressed baby saying, help me, because I can't help myself. I'm communicating. And just beyond the range of that communicating, that baby says, okay, nobody's coming. I'm doomed. And that's the sympathetic, slowdown, parasympathetic slowdown. And so for me, if I look at the nervous system of an adult or a human being, and translate it or extrapolate it to the baby. A lot of this, which is colic, which is crying, which is this, can be explained. It may not be a wholesomely true picture, but it's a huge contributing factor. I mean, it makes no sense for us to not approach it like that. So yeah, and but they're giving you say back to sleep, keeping the airway open. They're talking about not using lint. So yeah, basically looking at the very physicality of breathing, that your nose should not be blocked in any way and the baby will breathe. What if the mechanism of breathing is compromised because high rate of stress? How do we support our baby's regulation? How do we tell them that they're safe in the world? And we've talked about this over and over and over again.
Yeah.
And
Yeah.
not just babies, even when we talk about birth, we talk about the same thing about women. How do they feel safe? Because a lot of our body functions really well, brilliantly well. It's most extraordinary engineering when we are in that range of resilience, when we feel safe more often than we feel stress, which means we go to stress, but we come back. Innately, we feel safe. And we're laying those foundations. And as I was talking about this, very interesting thing came to my mind because in India, we take this malmal ka dupatta, a mother's dupatta, and we make it into a small, um, we turn it around and make a small pillow out of it, which we put
Yeah.
under the baby's
Put
head,
under. Yeah.
which takes the shape of the head, or we use rye pillows, which means what we're thinking about the shape of the head with some. So if you put a rye pillow behind your head and you put your head down, it'll get flattened from here, but a lot of rye will come on this side. It'll literally form a support system for the head. And when you use mother's dupatta, you're also taking her smell, which is yet a regulatory feature for the baby that, oh, my mother's smell is right here, I'm safe. So, these tiny bits, if you allow yourself to look at these infant pathways of how the baby is responding to the world and how you can interact, you'll find that many simple things that we did actually promote these pathways. We had an understanding of the baby before we had the scientific knowledge of the baby, so to speak, which we are still discovering. God knows where we are going with that. But it's interesting.
Okay. So someone's asking from which month can we follow tummy time for a newborn?
From day one. It could start with till about 6 weeks, about 5 minutes a day. And you'll get a lot of that if you are breastfeeding in the biologically nurturing position, which is reclining back baby on top of you or otherwise, as soon as the baby stops feeding, if you just lie back and put the baby on top.
Even
Uh,
burping, right?
so, people burp the baby here. I wonder why they do it here.
Standing, right?
I would do it here.
Yeah.
No. So when they're upright, no. But when they're leaning forward and they
Leaning.
have to
Yeah.
lift their head up, which means they're using these muscles to push themselves, that's when we consider it a tummy time. Because when
Okay.
they're lifting from here, they're actually exerting their tummy, pushing in their hips and knees. Think of yourself doing a press, moving up, like even with your knees and hips on the ground, pushing up. You're using this part of your body. It's opening up your chest. So you can right from the beginning till about maybe 15 minutes, and then you can move up to this is minimum values. It can go more than that. Don't look at the clock. But if you're giving them this much, then at least they're getting that kind of exposure, that kind of exploration of their body. Definitely.
Yeah, but never leave your baby in
No.
a tummy
So
time
not don't
position.
let them sleep that way. This is when they're awake. So the slogan that then AAP came up was saying that back to sleep and prone to play. Prone means on your tummy, for play. And this is why just the prawn is not important. The play is also important.
True.
Because you have to give the baby a reason to lift their head. If you just leave them on their tummy, they're going to cry. And then you say, oh, my baby doesn't tolerate tummy time. They don't like it. Of course, they don't like it. There's nothing to look at. They're human. These tiny things are helping them move through. So when they, like I said, you can put them on the bed and then go down, sit at the edge of the bed and look at them in the eye, because a lot of interaction in active alert is about, quiet alert is about audiovisual. If you hear Marshall Cross talk about it, and he says it's the play that arises out of it. You just can't look at somebody and talk to them without having an interaction, that you're being moved on a human level, person to person. And that's the important part.
Great. So I think that kind of answers all the questions and also covers our topic for today,
The strong baby.
the strong baby. So thank you so much, everyone, for joining us today or for our This Talking Tuesdays topic. We'll be back next Tuesday with our
The cry.
another topic, the crybaby,
Not the
and
cry baby, the crying baby.
the crying baby. Sorry, no crybaby.
It's
The
not cry
crying
baby, the
baby. Yeah,
communicating baby.
absolutely. And we will also be doing a small feature on prematures as well. Um, so yes, looking forward to seeing you all next Tuesday as well. Our this video will be up on our IGTV as well as on our YouTube channel. You can subscribe to our YouTube channel, My Child First, and view our other videos as well if you're interested. So thank you so much for joining us today.
Okay.
Thank you. Have a good week. Bye bye.